Today we're going to talk about one of the topics that generates the most curiosity and even a little fear in expectant mothers: normal childbirth. You've probably heard a lot of stories about it, some of them good, others a little scary, and it's normal for this to cause a certain amount of anxiety. After all, the moment your baby is born is something to look forward to, but it can also be fraught with doubts. In this video, I'm going to explain to you in a simple and straightforward way how normal childbirth works, from the first signs that the big moment is coming to the birth of your baby. The idea here is to demystify the process, so that you feel more confident and prepared. Normal childbirth is basically the natural process of giving birth, in which the baby is born through the vaginal canal, without the need for surgery, as in the case of a cesarean section. And, incredible as it may seem, our bodies are very well prepared for this. During pregnancy, it goes through several changes precisely so that everything happens in the best possible way when that moment arrives. But of course, as with any important event, you need to know what's going to happen, be aware of the signs, and, above all, trust the process. Before we dive into the details of how normal childbirth works, make sure you're subscribed to the channel. That way, you won't miss any upcoming videos, and you'll always be up to date on this incredible journey that is pregnancy. Now, let's take a closer look at what happens to your body when normal childbirth begins. In general, childbirth is divided into three main phases: the dilation phase, the expulsion phase, and the dehydration phase. But calm down, we're going to explain each of these phases very clearly. The first phase is dilation. This is the longest stage of labor and can often last several hours or even days, depending on the case. It begins when you start to feel the famous contractions, which become increasingly regular and intense. At first, these contractions may be spaced out, and many women describe this sensation as menstrual cramps, only a little stronger. With each contraction, the uterus is preparing for birth by helping the cervix to dilate. And here's the key point: the cervix needs to be 10 centimeters dilated for the baby to be able to pass through the vaginal canal. This process varies greatly from woman to woman. Some go through this stage quickly, while for others it can take longer. And how do you know you're really in labor? This is a very common question. Contractions are the main indication that labor has begun, but it's important to remember that they can be irregular at first. A good tip is to time the interval between contractions. When contractions start happening every 5 minutes and last about 1 minute, it's time to go to the hospital or maternity ward. But in addition to contractions, another important sign is the rupture of the amniotic sac, in other words, when the sac bursts. When this happens, you'll notice a clear liquid coming out and, in most cases, this indicates that the baby is ready to be born in the next few hours. If your amniotic sac bursts, tell your doctor and go to the hospital, even if the contractions aren't that intense yet. One thing that always makes first-time mothers curious is, does normal childbirth hurt a lot? Well, that's a rather difficult question to answer, because pain is very personal and varies from woman to woman. Some women report that the pain of contractions is very intense, while others say that they were able to get through this phase more calmly, with breathing techniques, relaxation, or even anesthesia, which is a very common and safe option in normal childbirth. The truth is that labor does involve discomfort and pain, but the good news is that there are many ways to deal with it. Health professionals, such as obstetric nurses and doulas, can help with relief techniques such as massages, positions that facilitate labor and, of course, emotional support. With dilation complete, we come to the second phase of normal childbirth, the expulsive phase. This is the phase in which the baby will finally be born. In this phase, the contractions continue, but now they have a slightly different function, to help push the baby out. And it's here that you'll feel that famous urge to push, as if you needed to go to the toilet. This is because the baby is moving down the vaginal canal and, with each contraction, you will be told to push to help the baby get out. Many women describe this phase as the most intense, but also the most rewarding, because it's the moment when you're very close to meeting your baby. It's interesting to note that a woman's body is designed for this moment. The pelvic bones move to make room for the baby to pass through and, with the support of the medical team and your strength, the baby gradually descends until its little head appears. This is the moment doctors call crowning, when the baby's head begins to appear in the vaginal canal. Until recently, it was common for doctors to make a small cut in the perineum, called an episiotomy, to make it easier for the baby to come out and to avoid major lacerations. Nowadays, however, this technique is used with much more caution and in really necessary situations. More recent studies have shown that, in most cases, a woman's body is able to adapt to the birth process without the need for this cut, and that excessive use of the episiotomy can increase the risk of complications, such as infections and more painful scarring. That's why episiotomies are currently only performed when there is a real medical indication, and in very few cases, because lacerations can be considered obstetric violence, so doctors avoid performing them. Then, after the baby's head comes out, the rest of the body slides out quickly. At this point, the medical team will help you hold the baby, and in a few seconds it will be in your arms. It's an emotional moment, and many mothers report that the pain disappears or diminishes greatly as soon as the baby is born. The joy and relief are so great that the discomfort seems to recede into the background. Now that the baby has been born, you may be asking yourself, is that all there is to it? Not yet. There is a third phase, called dechylation, which is the moment when the placenta, which was so important for nourishing the baby throughout pregnancy, also needs to be expelled. But don't worry, this phase is usually very quick and generally painless, as the contractions at this point are much lighter. In some cases, it may be necessary for the doctor to help by applying gentle pressure to the abdomen so that the placenta is expelled completely. Now that you know how normal childbirth works, it's worth remembering that, since the dawn of mankind, women have brought their children into the world naturally. This is the most common process and, over the generations, women's bodies have shown their incredible ability to adapt and prepare for this moment. The female body was designed to give birth, and this is a process that occurs instinctively and naturally. However, even though it is something that women have been doing for millennia, it is always important to have medical support during pregnancy and childbirth, ensuring that everything happens as smoothly and safely as possible. While we're on the subject, do you know what doulas are? Doulas play a fundamental role in childbirth, especially normal childbirth, providing physical and emotional support for women during this transformative time. Unlike doctors and nurses, who are focused on the clinical aspects and the health of the mother and baby, the doula is there to offer continuous support, helping the pregnant woman to feel safer and more confident. The doula's work begins long before the birth, right at the beginning of the pregnancy, with talks about what to expect at the moment of birth, relaxation and breathing techniques, as well as guidance on the birth process itself. She helps the mother understand her options and make informed decisions, always respecting the woman's wishes and birth plans. At the time of delivery, the doula's presence can be even more important. They help with techniques to relieve the pain of contractions, such as massages, changes of position and the use of breathing exercises, as well as providing constant emotional support, which makes all the difference to many women. The doula can also act as an intermediary between the mother and the medical team, ensuring that the pregnant woman feels heard and respected in her choices. Several studies have shown that the presence of a doula can reduce labor time, reduce the need for interventions such as analgesia and cesarean sections, and even improve the experience of childbirth for women, making it more humanized and less traumatic. Having a doula by your side during childbirth means having someone exclusively focused on your well-being, your comfort, and the birth of your baby in the most peaceful and empowering way possible. In other words, a doula helps turn normal childbirth into humanized childbirth. Take the opportunity to leave a comment telling us what you imagine this moment will be like, or, if you've already been through it, share your experience. Every birth story is unique and inspiring. And before closing, if you enjoyed this video and want to follow more content about pregnancy and motherhood, don't forget to leave your like and subscribe to the channel. This really helps us to keep bringing you important information and sharing this journey with you. See you in the next video.